Morning. Morning, everyone. Joined by the Director of Public Health, Dr Veitch, and Catherine Morgan-Rich. Dr Veitch will provide a short update and then take questions after me, and Kath will then provide an update on testing and vaccination, and I'll take questions post that. Now, I'm pleased to report that after another 24 hours of testing, where another 1,543 tests were completed, all results have once again returned negative, which is good news. But we're not through this yet. With 5 days having now passed since COVID-19 was confirmed in that case, with all contacts quarantined or managed appropriately now, we are getting more confident in saying that the risk of there being any further cases in Tasmania as a result is now low. But we're not through this yet. And obviously what needs to be understood is that testing, as we've got people in quarantine, they've had their first test. If that's negative, they can still present a positive test at a later date, and Dr Veitch can touch on those matters in a moment. Our public health officials will continue to manage and monitor the close cases currently in quarantine to ensure any risk is managed and responded to if required as matters progress through that quarantine period. Now, this case, whilst disappointing, has allowed us to test our emergency response, and I'd like to congratulate everyone from our biosecurity authorities through to our hotel quarantine staff and contact tracers for what has been a very big effort. And the work of our contact tracing team over the weekend was outstanding. To Tasmanians, I want to say thank you. It's been a prime example of when we do work together, how we can get things done. Tasmanians have turned out in droves to get tested. Importantly, through the lab in the last 4 days, nearly 6,500 tests have been run. It's important that we keep, though, our testing response up, and that I'd encourage Tasmanians to use this case as a wake-up call. We're not immune from COVID-19 here in Tasmania, and the Delta strain is a different ball game. Let me be absolutely clear about that. We've got New South Wales now locked down for who knows how long, and obviously other cases that we're seeing around the country. One other step that we're going to take, and I want to announce that from 6 p.m. on Friday this week, the 13th, all Ubers and taxis will be required to have a QR code check-in system in place, and we'll work with Uber and taxis and taxi companies over the course of the week. There's been work that's been underway on this, and it's been under consideration for some time. I'm pleased that we'll introduce that now. Further consideration of buses and other forms of public transport will be considered as well, but noting that in terms of other jurisdictions, not all have moved to QR codes on public transport. The reason being that with public transport, there is a defined route and times, and so if, for example, someone were to have a case on the bus that was coming in from Glenorchy this morning that had left a certain spot at a certain time, then we can message that up and provide messaging to the people that were on that bus. But again, we'll work through that, and we'll provide further advice as we move through the course of the week. As I've said, New South Wales continues to face a very serious situation. They had over 260 cases yesterday, and obviously an update will be provided soon. But that is a very challenging situation. Victoria, 11 new cases reported overnight. Unfortunately, only one in quarantine during their infectious period. And so we will obviously continue to monitor that, and the Director of Public Health and his team will continue to engage with AHPPC on a daily basis with those jurisdictions. Tasmania's border restrictions with New South Wales and Victoria remain in place. I just want to remind people New South Wales is classified as high risk level 1, Victoria classified as high risk level 2, including a large number of high risk premises in Victoria, and the bottom line is if you've been to one of those premises at the time, then you simply can't come to Tasmania. Queensland Government announced yesterday the lockdown of the 11 southeast local government areas ended at 4 p.m. as of yesterday afternoon. Public Health will continue to monitor the circumstances in regards to those 11 LGAs, but our border restrictions still remain in place with those 11 LGAs, but we'll update in coming days. Yesterday, Tasmania declared the Cairns and Yarrabah regions as high risk level 2 from 4 p.m. as in lockstep with the Queensland Government's decision to declare that 3-day lockdown for those regions. Now this means that from 7 p.m. yesterday, the 8th of August, any person who's been in the Cairns and Yarrabah regions on or since the 29th of July will not be permitted to enter Tasmania unless approved as an essential traveller. If approved, you'll need to quarantine in a suitable premises for 14 days. A stay-at-home order has also been implemented, meaning anyone who is currently in Tasmania, who has been in the Cairns and Yarrabah regions on or since the 29th of July and has not been directed into home quarantine, that could be somebody that travelled in recent days, should follow the stay-at-home restrictions. This direction will be reviewed daily as the Queensland situation evolves, and obviously that's currently in place for Cairns and Yarrabah for 3 days, but we will continue to monitor and provide further information as that progresses. As of yesterday, Public Health had contacted people in Tasmania who'd reported being in Queensland in the past 14 days by SMS to provide these details to them. I do want to remind people of what a stay-at-home order includes. It means that a person may leave home only for the purpose of shopping for necessary goods and services, access to medical health treatment or supplies, including to be tested for COVID-19, but does not mean leaving to get a vaccination. If you've been placed on a stay-at-home order, we don't want you turning up at one of our vaccination clinics. Be tested, but importantly, don't continue with a vaccination appointment at this point in time. Contact the Public Health Hotline or the Vaccination Centre and change your appointment. You can attend work or school if that is unable to be undertaken at home, and to undertake personal exercise, noting that exercise can be undertaken with a person from your household, including a carer, or with someone else for safety reasons, but under this order, all exercise activities must be conducted within a 5-kilometre radius of your home. Under a stay-at-home order, you can leave Tasmania. If you're under a stay-at-home order, you are not in quarantine, but apart from those rules, we'd ask that you stay at home or in your premises. In terms of shopping, I just want to touch on that, and it's been questioned on a couple of occasions. You can shop within 5 kilometres home, at 5 kilometres of your home, unless the necessary goods or services are not available in your area. As I've said, exercise must only be undertaken outside with members of the household or one other person. When leaving home, masks must be worn unless exempted. People bound by this stay-at-home order must not have visitors. I urge anyone who has questions about their personal situation to please contact the Public Health Hotline for advice on 1800 671 738. So again, I just encourage Tasmanians to stay on top of COVID, ensure that you continue to do the little things. If you have any cold or flu-like symptoms, even mild, immediately self-isolate, contact the Public Health Hotline, ensure that you have good hand hygiene, that you socially distance, that you follow the rules. Please use the Check-in Tas app whenever you enter a business or a venue displaying the Check-in Tas QR code. It's important that we have that data. I'll hand over to Dr. Veitch. The final message is, though, that if you're one of the people that is able to receive a vaccination now, turn up and get the vaccination. It is important. And if you're over 60, please call and we'll help you find an appointment. The vaccine is your biggest protection against this deadly virus. I'll hand over to Dr. Veitch.
Thank you, Premier, and good morning. Just before starting, I'd first like to acknowledge 3 groups of people who are in my mind at the moment. Firstly, the 6,000 Tasmanians who went out and got tested over the last 4 days. That's fantastic. Some of those people are people who have been identified through the contact tracing, but the majority of those people are Tasmanians who've come forward, perceive that they may be at risk of COVID, have symptoms, and gone and got tested. And that's tremendously helpful for us to understand whether there's anything significant going on in the Tasmanian community. So that represents people recognising that if they've got a mild sniffle or a cough, that they're going and getting tested. So please keep that up. The second group of people I would like to acknowledge, as the Premier has done, are the people who worked on the contact tracing and responses over the weekend. So that's people on the hotlines, people doing the testing, people doing the contact tracing. They've done a fantastic methodical job, something they've trained for, but it's been very taxing. And the third group of people is the Tasmania community, who I know some of whom will have been practically disrupted by the consequences of the matters over the last few days for themselves. Other people will have been made uneasy because of what's happened. So I think that's important that we acknowledge that this affects everybody. I'll just touch briefly on the contact tracing and the response to Queensland, and then I'd be happy to take any questions. The contact tracing is proceeding well. We've identified 187 people who we have classified as one or another kind of contact. 108 of those people are primary, what we call primary close contacts, and of those, 82 of them are people in Tasmania who were on that Virgin flight that came in last Monday. A number of people from that flight have already left Tasmania and returned to mainland states. The other people that make up the 187 contacts are 11 casual contacts who have a more remote exposure to the case, and there are 66 people who we classify as secondary contacts. Secondary contacts are people who we have asked to quarantine because they have been in contact with a primary close contact, such as someone on the airplane. And as soon as you get a negative test on your primary close contact, you can release that secondary close contact from their quarantine requirements, because once you know the person they're being in contact with doesn't have the disease, then it means that these secondary contacts can be released. And over the next couple of days, most of those people will be released, and so you'll actually see when we report each day that the number of contacts will drop down to closer to 100 rather than being up near 200. We're going to monitor all of those people out to 14 days with an appropriate testing regime, and that's how we make sure that nobody in close contact with the case has become a case themselves. The good news is that I think 72 of the 82 people on the Virgin flight have completed a test. Some others, the test result will be coming through over the next 24 hours. For a couple of others, the right time to do that test is in the next day or so. So it'll be good to have those tests all through in the next day or so. The taxi driver and the bus driver that people will have heard about have returned negative tests, and that's really important for the people who travelled with them. In the case of the bus, it was really, I think, only one other person who was transported to the hotel, but the taxi driver may have subsequently had contact with people during their work, but since the taxi driver has tested negative, they don't pose a risk to anyone who they subsequently transported. So that work will go on and it will continue through this week and into next week. The other notable concern over the weekend was the identification of a taxi driver in Cairns who'd transported people over a number of days while they were potentially infectious to them. And we have managed that by following the approach that Queensland has done, which is Queensland has put the local government area of Cairns and Yarrabah into lockdown, and we have listed those as high-risk level 2 areas, so people will not be able to enter Tasmania without approval from the Deputy State Controller if they've been in those areas. As far as people who've been in Cairns in the last couple of weeks, since the 29th, we have sent, 29th of July, we've sent an SMS message to everybody who's come into Queensland since that time. That obviously includes a lot of people who won't have been to Cairns, but it will obviously include those who have. Those people have been asked to identify if they've been at Cairns or at Yarrabah, and if so, those are the people to whom the stay-at-home order applies. Over the course of today and tomorrow, we are going to interact with that larger group of people who we've contacted by SMS with an online survey to identify those people who actually were in Cairns, and so we can manage their testing requirements over the coming days. I'll just leave it there.
Questions? Yeah. If you've been fully vaccinated and you get flu symptoms, should you still get tested?
Good question. Yep, if you've been fully vaccinated, you can still catch COVID. The good news is that if you've been fully vaccinated, you're very unlikely to become seriously ill, but you could get mild symptoms. We know that there's an increasing proportion of people in Tasmania who have been vaccinated, but even so, please, in these current times, if you've got any symptoms, please go and get a COVID test.
How many people are there in Tasmania that have returned or come from that Cairns region since the 29th?
We'll be working that out over the next couple of days. We know that there have been about 9,000 people who've come back to Tasmania since the 17th, which is in fact even further back into July. But we will need to do some work to work out how many of them have been in the Cairns area and how many of them have been in the Cairns area since the 29th. So it's obviously going to be a fraction of those people, of those 9,000. But because when people come over the border, they don't tell us everywhere they went in whatever state they're in. We have a process of getting back to them with a survey to identify the people who've been in places of interest.
We move to Catherine Morgan.
Thank you, Dr. Veitch. So there was a strong turnout for testing over the weekend, and I'd like to thank all Tasmanians who took the time to book the test and did not wait. We had 1,158 presentations to testing clinics yesterday and 1,543 tests processed in the laboratories. As the Health Minister said yesterday, this is far more than we would normally see on a weekend, so that's a very, very significant result. As the Health Minister said yesterday, our testing clinic at Wellington Street in Launceston is open until 9 p.m. tonight, and while our Macquarie Point in Hobart and our Burnie and Devonport clinics are also open. We've already had around 350 bookings for these sites today, and I ask particularly our northern Tasmanians, do not ignore a sniffle, a cough or other cold symptoms. You can ring and we will have a time for a test to you within 1 to 2 hours. There are hundreds of appointments available, so if you need a test, please book one online at www.coronavirus.tas.gov.au or ring the Public Health Hotline on 1800 671 738. On vaccinations, as we remind Tasmanians every day, the best way to safeguard yourself, your loved ones and your community is to get vaccinated. Going by the statistics over the last couple of weeks, Tasmanians are hearing the message and are responding in their thousands. We passed 350,000 doses delivered in Tasmania over the weekend, and that's over 50,000 doses delivered in the past 2 weeks, meaning that Tasmania is well on track to reach its target of 70% of eligible Tasmanians fully vaccinated by the end of October and 80% by the end of November. The total as of last night stands at 351,829 doses, with just less than half of those delivered in our state clinics. Over the past 3 days, we delivered 5,430 doses in our state clinics. Now that is great news, and I thank Tasmanians for supporting the push to vaccinate our community. Of our eligible population over 70 years, over 84% of people have now had their first dose and 53% are fully vaccinated. For our over 50s, over 72% have received their first dose and over 36% are fully vaccinated. And that's a great result, but there is still more to do, particularly among those over 70 who are yet to have had their first dose. While getting vaccinated is a personal choice, I can only urge those who have yet to be vaccinated or remain hesitant to please have that chat with your GP or clinician. As a reminder to all that as we move into August, we have the following types of vaccination clinics operating: state vaccination clinics, which continue to offer dose 2 AstraZeneca and dose 1 and 2 Pfizer, general practitioners that offer dose 1 and 2 AstraZeneca, and some now offering dose 1 and 2 Pfizer. And in a week's time, next Monday, the first stage of our community pharmacies, which will offer dose 1 and 2 AstraZeneca to the over 60s to help fill the gap for that age group and the fact that state clinics have moved to Pfizer for dose 1. We are working with the Commonwealth to bring on more community pharmacies, and we'll look at an expansion of their age range and vaccine types as the rollout progresses. There are bookings now available across the state, so please book now, don't wait, vaccinate. Finally, there is good news on the vaccination front in terms of a new vaccine being added to our existing supplies, with the expectation that the Moderna vaccine will be approved by the TGA in the coming 2 weeks. If everything goes smoothly with that approval process, we can expect Moderna to become available nationally in September, including to Tasmania, with availability increasing in October. And Tasmania will be working with the Australian Government to ensure that it receives adequate supplies of the latest vaccine, in addition to Pfizer and AstraZeneca, as we step up our vaccination effort through the rest of this year. So open for questions.
Are you worried about our current supply of Pfizer being diverted to New South Wales, given the situation, over the next few weeks? The Pfizer shipments that are due here, are you worried they'll be diverted elsewhere?
So our supplies of Pfizer and in fact AstraZeneca have remained strong. So in terms of the figures that we are allocated by the Commonwealth Government, and it's a per capita distribution to Tasmania, that has remained constant. I know that there has been talk, for example, amongst our premiers in relation to National Cabinet about the call for vaccines to be redistributed, but that has not happened for Tasmania.
What are your tips and tricks for getting an appointment sooner rather than later?
For vaccination. So certainly I really do encourage everyone to hop online or to make that call to our public hotline to get your booking in. Now we do add thousands of appointments every single week, but once you're actually registered, and particularly for those of you that are using the online service, you can check at any time to see if there's been cancellations or if you can see that there's a new date or a more available date for the vaccine. And we will also continue to publish as we've got more appointments that are being added, or if we open up new clinics in new areas.
When can we expect all eligible Tasmanians under 30 to be able to access Pfizer?
So our under 30 population, so our 16 to 29s, in fact our 12 to 29s now with an underlying medical condition, for our older part in that group that may be pregnant, for example, they are eligible now for a vaccination. So it's the more general, which is what we're looking as the vaccine supplies increase, particularly into September and October. So we'll be expecting in the next few weeks to make an announcement about that age group.
Okay, so it will open within the next few weeks.
Noting that Tasmania was the first to announce, for example, the opening up of the 30 to 39 age group. So we're really making sure that that age group has had that opportunity to book in, particularly off the back of the Doherty modelling, which has been released, noting that that age group, the 30 to 39s, need to be a key priority to make sure they're vaccinated. So if you are in that age group, please do make a booking now for vaccination.
As the vaccine supply increases, do we have enough staff to administer those vaccines, or do you need to recruit more people into the system?
Certainly our recruitment is every single day and ongoing. So, and that is a key point in Tasmania, that we need to make sure that we do get anyone that actually has some spare capacity, and we're talking about registered nurses, enrolled nurses, our paramedics have also been approved to provide vaccination, and it's the reason why we're also bringing on our community pharmacies from next Monday. We've got 11 that start next Monday, we have another 15 that start the fortnight after that, and we'll look at then at the remainder of the 105. But it is about matching those resources to the supply of vaccine that's coming into the state.
Questions for Brilliant?
Thanks.
We saw over the weekend a 48-year-old man fined for breaching orders for entering Tasmania when he shouldn't have. Why wasn't that 31-year-old who tested positive for COVID also fined?
Well, I'd make the point, in terms of that 31-year-old, I believe that the New South Wales Police have fined him in terms of breaching their order there. But in terms of the circumstances here, obviously he arrived, he was placed into quarantine, he was tested. Unfortunately, he left before he'd been tested. Operationally, police have obviously made a judgment that in terms of our directions that he wasn't in breach. But in terms of moving forward, and I've made the point very clearly that those people that want to travel here, that want to attempt to enter the state after they have been rejected, and that is an offence, after they have been rejected, then we'll throw the book at you.
Shouldn't there be a more heavy-handed approach, though, for situations like this? I mean, we've now seen thousands of people have to get tested and you know, there's been concerns about COVID spreading in the community. Shouldn't this 31-year-old have just been fined in the first place?
Well, again, in terms of the circumstances regarding that particular individual and his entry into the state, he was picked up at our border, attempted to fill in, as I understand it, a paper-based application form. Off that, he was identified as having been in a high-risk area, and then our system placed him into quarantine. If that person, or if any person, now arrives in the state where they have been previously rejected and not allowed to travel, then there are infringement notices that can and will be issued.
So you're going to introduce QR codes in taxis and Ubers. What's the situation for buses again?
Okay. In terms of public transport across the country, there are varying levels of rules that have been applied. In terms of Ubers and taxis, by Friday of this week, in terms of times at 6 p.m. Friday, they will need to have a QR code in place. We're still doing some work on public transport. One of the reasons that other states haven't included public transport in their QR code testing is that routes are well understood and buses leave at certain times, and so therefore should somebody have travelled, you have that opportunity to identify who was on that particular section and publicly message them if they need to self-isolate. But I think it's probably a step that we do need to take, and we're doing some further work on that in terms of public transport.
So does that process rely on the bus driver reporting who was on their bus trip, not the passenger, making sure they get that route correct?
Well, that's what would happen would be, in terms of the current situation with our contact tracers, if somebody was identified, we go through all of their movements. They'd identify to us that they were on that particular bus, then we could message up that they were on that bus that left at 8:05 from Glenorchy travelling to the Hobart Transit Centre, and we could message up to those people that were on that bus that they would need to take certain steps. But I think, as I've said, I think it's probably a sensible step to include QR codes on buses and public transport, and we're working through that. But other states haven't, for the very reason that I've just outlined, that you've got a defined route and you've got defined schedules, and therefore you can message up who might be affected.
Why weren't QR codes introduced in taxis and Ubers months ago?
Well, look, there's a fair bit of work that was undertaken by Public Health. Obviously, we've now made that decision that they should be included. Again, Public Health assess these matters on a risk basis. You know, in terms of Delta, that has changed the circumstances, and they'll now be included.
Premier, just onto other issues. Is North West Tasmania given enough priority for mental health funding?
Look, in terms of that night, and I've seen some of the stories over the weekend that have been reported, and my heart goes out to the people involved, the parents especially. You know, it's a tragedy if any life's lost under these circumstances. For a parent, it must be almost unbearable. Look, in terms of the resources that we applied across the state, as you'd be aware, you know, we've recently adopted the recommendations of the CAMS review. There'll be $45 million worth of additional investment, you know, plus specific investment in terms of the Burnie Regional Hospital as well there. It's challenging, I understand. Our resources are deployed on a state-wide basis. And I would encourage anyone, I actually brought in with me the numbers that people should call, and I would encourage them, you know, if they are in these challenging circumstances, that there's a kids helpline, you know, 1800 55 1800, 1800 55 1800. There's also a Tasmanian Lifeline, which we established as part of the COVID response. We accept that, you know, and understand very clearly, as does our community, that as a result of COVID, you know, many people are in far more stressful situations. And so that Tasmanian Lifeline, a Tasmanian Lifeline number, which we funded, will continue as well, and has been, and that's 1800 984 434, and obviously people can call the Lifeline number itself, which is 13 11 14. You know, I'd encourage people to reach out and ensure that they engage should they be in challenging circumstances, because as I've said, no one wants to see this occur.
The Dual River Ferry Service.
When will the money from the CAMS reforms filter through to the North West?
Well, in terms of the CAMS reforms, that's fully budgeted. Obviously the budget will be brought down and work will be underway.
The Dual River Ferry Service commenced operations this morning. What would the message be to Hobartians to encourage them to catch the river?
I think very clearly for those that want to experience the ferry, those that live in the area are able to cycle to the ferry or catch a bus to Bellerive and leave from Kangaroo Bay. I'd encourage them very strongly to try this. People have for a long period of time been calling out for a trial of ferries. There is now one. I'd encourage Hobartians to use it. Let's make certain that this is a success and we can then look to build on it.
Why isn't there a dedicated youth mental health ward or inpatient centre in the northwest, and is that something that you would commit to doing?
Well, in terms of the investment that we're making, I might ask Kath to speak to that. During the election, we announced further investment of around 95 million, which includes specific investment into new facilities and upgraded facilities in the northwest. But Kath might be able to provide some further detail on that.
Yeah, just another quickly on COVID. What support's available to Salamanca Market stallholders who've been struggling lately?
Look, as I've indicated, I've begun a discussion with the federal government in terms of additional supports that might be required for the tourism, hospitality and events sector here in Tasmania. For obvious reasons, the focus of the federal government and state governments in Victoria and New South Wales have been providing additional ongoing support as those states are in lockdown. But there are second order impacts, and we're feeling it here in Tasmania. South Australia will be feeling it as well, as will the ACT and the Northern Territory. And so we've begun the work with the federal government to look at what a package might provide. And obviously from the state's point of view, I've always said that if we need to do more, we will do more. And right now, in terms of the Victorian situation, looking like it will drag on for longer, and also the New South Wales situation obviously being a medium-term type issue before that market comes back, we'll need to provide some support.
I think
Just
you
on-
touched on this a little bit yesterday, but can you just elaborate on what the task force with the ACT and the NT will involve?
In terms of
The COVID task force with those states.
well, there's a task force in place with Tasmania, Victoria and the Northern Territory, not the ACT. That was established through National Cabinet, and the work that we're looking at there are, in terms of the four-step plan that we've outlined, which currently we're in step 1, which is suppression, and then at 70% we'll move to step 2, 80% to level 3, and then hopefully we can move on to stage 4, which is where we go about our business with, as best we can, a fully vaccinated population. Obviously the work that's being undertaken there is looking at vaccine passports, the sorts of incentives that might be required to ensure that we can get as many people vaccinated as possible, and also looking at what the rules underlying the 4 steps might be, taking into account a large state's view, a smaller state like Tasmania plus a territory.
Just on
Can I just go quickly back to buses? What do you do if you happen to not make note of the exact route that you've travelled on and the contact tracing has to take place?
Well, in terms of, as I've said, in terms of buses and public transport, we're doing further work on that this week. My expectation is that we will introduce QR codes to public transport. But in terms of our contact tracers and the work that they do, and what we, like to say, we had the very challenging situation in the northwest. The interviews that are conducted are comprehensive. In most cases, I think most people would understand if they had travelled from Glenorchy through to Hobart or from another suburb, or likewise in the north of the state. And again, utilising timetables and the known routes, we're confident that we would be able to track and trace and certainly message those people that were involved on that bus should there be a case. But as I've said, taxis and Ubers from 6 p.m. on Friday, and further work will be undertaken on public transport.
Premier, over the
Just on
weekend,
salmon, how comfortable are you that one of our biggest salmon companies will be out of Tasmanian and out of Australian hands?
Well, obviously, I'd much prefer, as with many Tasmanians, that our businesses were owned by Tasmanians or Australians, but we live in a global community, and I think that most people recognise that in terms of many of our large businesses, both here in Tasmania and interstate, that they're part of a global community, and therefore They may not be owned by Tasmanians directly or Australians. In terms of this current situation, as I said over the weekend, JBS have been in the state for a long period of time. I worked with them directly when we had the challenge with the pork industry, and as I said on the weekend, they were a very reasonable corporate citizen to deal with then, and I'm sure that they would be a responsible corporate citizen moving forward. But there's obviously some steps to be gone through. The shareholders need to agree to the offer, then obviously they need to, the FIRB approvals at a federal level need to be conducted as well.
Very much go back to Kath for that question.
Just one more for the Premier quickly. Over the weekend, iconic Tassie band the Wolf Brothers hit number 6 on the official ARIA albums chart with their brand new album Kids on Cassette. As Premier, how does it make you feel to see such great success?
Actually, I saw that reported, and I think that's fantastic. Well done. Doesn't surprise me that they're turning out the hits. They are a fantastic band.
Thank you, Premier. So, in relation to mental health services in the Northwest, and can I start by saying that every suicide is an absolute devastating loss for the families, for their friends, for their workmates, and for the community. And my heart does go out to every single family that's impacted by suicide in Tasmania. In terms of turning to the comprehensive review that has been undertaken in relation to child and adolescent mental health services, that review was released last November. Every recommendation that Health put to the government was accepted in relation to that review, and some $45 million will be invested in relation to that, what is a long-term mental health reform. Certainly, in terms of recent commitments, we've also had the commitment from the Tasmanian Government in relation to mental health in the home services. So our mental health hospital in the home service, which we will look at for the Northwest, certainly as a priority. We have been very lucky to secure the services of Dr. Brett McDermott, who was the instrumental author in relation to the CAMS review, and he has joined us in Tasmania to be the statewide clinical director for mental health services, and we are just so lucky to receive and have him move down to Tasmania as the author of the report and actually taking through and being responsible for the implementation of the recommendations that he's actually made to the Tasmanian Government. So if I can reiterate in terms of the Premier's words in relation to care, to really reach out. The Premier mentioned the Kids Helpline, so targeting children up to the age of 17. The Premier mentioned also our Tasmanian-funded A Tasmanian Lifeline, which was created during COVID for children to reach out. And noting that with our existing CAMS service that we do triage every single call that is made to our existing child and adolescent mental health service, in addition to presentations, for example, to our emergency department for people that are experiencing particularly acute mental health episodes, and for example, our short stay mental health units. Now, there was a question in relation to the investment on infrastructure in the Northwest. And we have, as the very first stage of our master plan investment in the Northwest Regional Hospital, will involve the construction of a standalone mental health precinct, and that will be in terms of the integration and really looking at the recommendations and the changes to the models of care that we actually have to get in place to improve our mental health services in Tasmania.
Can you just give an explanation as well of what mental health hospital in the home, what care does that provide to people who are part of that program?
So mental health hospital in the home is a service which is still an acute service, so for people that have presented either to our community team and have been triaged or have presented to our hospitals who are suffering from an acute mental health episode. And hospital in the home means that they have been assessed by a specialist, so whether it's a psychiatrist, whether it's a psychologist, and they're put into an acute program, which means that there is every single day that follow-up and making sure that their clinical care is looked after. So it is actually allowing for those people that are a part of that service to remain in their homes and provide those supports to families. But we recognise that we need to do more, and that's why we need to increase our investment in relation to mental health hospital in the home, and that's what we are working on now.
And the mental health precinct at the North West Regional Hospital, what services will be available there and who will that cater for?
So it will actually replace our Spencer Clinic that's at the North West Regional Hospital, which at the moment caters for all ages. And we will look at the recommendations about actually having separated care for our child and adolescent mental health services and also our adult, but also our geriatric care. So remembering that we need to provide mental health services covering the full age spectrum.
Okay, that's all.